Good morning to everyone. I am Prof.Manavalam. Now we are going to see about the cardiotocography part 3. It is a continuation of part 2. In this part 3, we are going to discuss about the in detail on there is a variation in the fetal heart rate, that is baseline heart rate. There is acceleration, deceleration and a variable deceleration. There are different types of deceleration, and as a whole overall how we have to interpret the CTG readings. Everything we are going to see in detail in this video. Let us move on to the video. First one is the acceleration. It is nothing but is abrupt increase in the baseline fetal heart rate greater than 15 beats per minute over a 15 seconds period of time. Actually, the presence of acceleration, it is indicating the fetus reassuring. It is indicating the healthy fetus. Acceleration, actually the acceleration or deceleration, whatever it may be, it is occurs alongside of the uterine contraction. So because of uterine contraction, definitely I said there is a variation in the fetal heart rate. So this variation is acceptable variation, means it is indicating the sign of healthy fetus. In this graph sheet, it is shown that acceleration. So already I said the below sheet, it is the reading has given as a contraction. In this 10 minutes window period, there are two contraction is there. Along with contraction, there is a variation in the above sheet. There is a variation in the fetal heart rate. Actually, how the acceleration process it will start means whenever the mother experiencing the contraction during the time of labor, that time there may be a variation in the baseline fetal heart rate. That also it will be increasing 15 beats per minute and it remains there for 15 seconds. After that it will be comes down. So that is called as a acceleration. It is indicating healthy fetus. Next, move on to the deceleration. This is the opposite to the acceleration. There is abrupt decrease in the baseline fetal heart rate greater than 15 beats per minute and it is more than 15 seconds it will be remain. The mechanism behind the deceleration. Why the fetus is reducing its heart rate in order to adapt certain the physiological process that is happening during the time of labor. Actually, the fetal heart rate is controlled by the autonomic and the somatic nervous system. Whenever the fetus is descending down into the lower pole of the uterus, the time the contraction getting increased, there is a chance of placental supply of blood which will be decreasing. In response to reducing placental supply, the fetal hypoxia it will be occurring. Because of the fetal hypoxia, there is a physiological adaptation in the fetus cardiac system. So it shows a sign of reducing the fetal heart rate. Why the fetal heart rate is getting reducing means in order to preserve the oxygen that is needed for the myocardial tissue perfusion to maintain the cardiac system functions. So this is the basic mechanism behind the deceleration of the fetal heart rate. It is considered as a normal deceleration is considered as a physiological, doesn't mean as a pathological. There are different types of deceleration, other early deceleration, late deceleration and variable deceleration. First we will see about the early deceleration. Early deceleration means, according to this graph sheet, it is clearly shown, I think. Early deceleration, it starts when the uterine contraction begins. It ends when the uterine contraction stops. So it is occurring alongside of the uterine contraction. So the deceleration, that may be a decrease of fetal heart rate 15 beats per minute for 15 seconds period of time. The cause of early deceleration is because of increasing the intracranial pressure. Because of this, there is a changes in the fetal vagal tone. Increasing the vagal tone, that shows the variation in the fetal heart rate. Once the compression of get relieved, head compression is getting relieved means there is a recovery of intracranial pressure. So normal vagal tone, it will be recovered fast. Then the fetus comes into the space of baseline fetal heart rate. Next, reason for late deceleration. Late deceleration, it is begin when the uterine contraction reach its peak, and it ends when the uterine contraction stops. After the ending of uterine contraction, it recover back to the normal state. The reason of late deceleration is the placental insufficiency. It causes for fetal hypoxia and fetal acidosis. Other causes of late deceleration is maternal hypotension. It has a direct impact on the fetal cardiac system. Preeclampsia, and uterus is hyperstimulated by the administration of oxytocin medication. Next, to move on to the variable deceleration. So variable deceleration is there is a rapid fall of baseline fetal heart rate in a variable recovery periods. It has the variable recovery periods, and also it does not any correlation with the uterine contraction. So it occurs in a variable time period, and also it ends in the variable time period. The reason of the variable deceleration is umbilical cord compression. So this is the reason for variable deceleration. The mechanism behind the variable deceleration, usually the umbilical cord, it consists of umbilical vein and umbilical artery. So whenever the umbilical vein is getting occluded during the time of uterine contraction, first there is a acceleration of the fetal heart rate is present in responsive to the umbilical vein occlusion because of uterine contraction. Followed that the umbilical artery is getting occluded, that cause for subsequent rapid deceleration of the fetal heart rate. Whenever the pressure is relieved over the cord, automatically there is a acceleration occur and the baseline fetal heart rate which will be recovered back. This is the mechanism behind the acceleration and deceleration process. Next, to move on to the sinusoidal pattern. Sinusoidal pattern means it is nothing but it is smooth, regular, wave-like pattern that is present in the cardiotocograph graph sheet. It doesn't showing any beat to beat variability. Only it shows the baseline fetal heart rate between 120 to 140 beats per minute. There is no variability, baseline variability, no acceleration, no deceleration, nothing shown in this pattern, sinusoidal pattern. It is mainly indicating, it is a one kind of bad, it is not indicating a healthy fetus. How we have to interpret the overall results of the cardiotocography. So till now we seen about the various parameters that is monitored by using the cardiotocograph. That is contraction, baseline fetal height, baseline fetal heart rate variability, acceleration, deceleration. So as a whole we have to combine everything as a together, and we have to come for a final conclusion. In that final conclusion, it is divided as a reassuring and a non-reassuring. In case of reassuring, it is indicating healthy fetus. The fetus must have the baseline fetal heart rate between 110 to 160 beats per minute, and they must have the baseline variability between 5 to 25 beats per minute. At the same time, sometimes the fetus may like acceleration, deceleration also it's okay, but it is minimal deceleration is acceptable one, or early deceleration is acceptable. The variable deceleration is not at all acceptable under reassuring category. Next, non-reassuring. So the fetus needs some attention in order to save the life. In the baseline fetal heart rate between 100 to 100 beats per minute, 109 beats per minute, or 161 to 180 beats per minute. The baseline variability may be less than 5 for 30 to 50 minutes, more than 25 for 15 to 25 minutes. So it is indicating the fetus need immediate attention. Thank you all. So we have seen detailedly about the cardiotocography, the machine commonly used to monitor the fetal heart rate and uterine contraction during pregnancy, as well as the labor period. Cardiotocograph, the machine used for this is called as a cardiotocograph.